Oh, that's good to know.
When I was a M1 or M2, that year, the ophthalmology match was quite bad here for Cincinnati. We went like 1 for 9, 1 for 8, something like that. And so I didn't discover ophthalmology until M3. But even years before discovering ophthalmology, the reputation, at least in my group of medical students of ophthalmology, was that this is a super, super competitive specialty that is very hard to get into. And I feel like we had a great match cycle this past cycle. And since I've been a resident, and honestly, since I've been a medical student, we've been very successful in matching medical students and getting them into ophthalmology, oftentimes at the program of their choice. And I think you are in part a large reason for that happening, which I want to get into in a bit. But you said you're director of medical student education for ophthalmology. When a student comes to you for the first time, either as an M1, M2, M3, even M4, depending on when they discover ophthalmology, they voice interest. How do you tailor your approach to those meetings, and how do you sort of individualize the guidance you give students?
I individualize is really the operative word. And it depends on where they are, whether it's an M1, M2, or M3. And what I usually start off is I want to know who the student is, what their interests, where they go undergraduate, what did they major in what are their interests? And to begin to understand enough about them to imagine where in ophthalmology would be a nice entry point. So, for instance, if a student comes to me and says, I did a lot of oncology research as an undergraduate, that would take me in a maybe different way from somebody who was in bioengineering and liked techniques and procedures. The pairing up, the mentoring might look very different, knowing about the student. And some students will come to me and they are already pretty certain that they want to go into ophthalmology. Other students are not at all certain. And I think it's really important to let students know that medical school is the time for exploration. And so I feel like I've done my job well if you land in a specialty that suits you and makes you happy. And I certainly hope that will be ophthalmology. But if it's not, certainly don't feel like you have to, be willing to sign in blood that you're going into ophthalmology before you come to speak to me. So I really try to keep an open door policy. And I think that encourages people to come and meet with me earlier in their medical school career, rather than to wait until they're in M3 or about to go into M3 and relatively certain, and then think that that's the time to come by and visit.
I really think your approach to mentoring and advising medical students is wonderful, and I think it's spot on. When I met with you for the first time, I remember our conversation vividly. It was at the conclusion of M2, and I had just taken step 1. And I had spent the first 2 years of medical school thinking I was going to go into a specialty that I eventually realized I just couldn't see myself doing for the rest of my life. And so I really wasn't sure what I was going to do. And I kind of just sent out some scattershot emails to the heads of departments or liaisons for medical students in specialties which I felt like I had not been exposed to in medical school. And one of those was ophthalmology. But immediately before our meeting, I had met with the dermatology department. And the conversations could not have been more different. The disparity between the two was absolutely huge. The conversation with dermatology was much more, okay, here's what your step 1 score is. Here's what your current class rank is. Here's the kind of research you've done. This is sort of the percentage chance you have of matching into dermatology based on all of that. If you wanted to increase your chances, you could, do this many more publications. And exactly as you mentioned, 30 minutes later, when I get to your office, I was expecting somewhat of a similar conversation. But the first thing you said was essentially like, what has your experience in medical school been like? And then 1 hour later, I'm leaving your office. I'm like, that conversation did not at all go like I expected. But I left feeling like you, someone who I probably didn't interact with very much in the first 2 years, despite you being a block director for Physician and Society, had just taken so much time to invest in getting to know me. And I felt like I had a lot of confidence in you. And I felt like already we had a good relationship. And I felt very comfortable navigating discovering ophthalmology and then eventually applying for ophthalmology and matching into that. So I really, really like that approach. And I think it is honestly one of the reasons we have been so successful here at matching students in ophthalmology.
Well, you're very, very kind to say that. And for me, the fun of it is really that relationship. And unfortunately, sometimes I have to say things that are not always what students would love to hear. Um, but it's important for me to be um, supportive, but truthful, because too much rides on the decision and the whole process for me to tell students anything other than what I believe to be true. But it is very different to do that based on a relationship where students know, I hope they know, that the direction that I come from is really trying to promote what works best for them and outlining where things stand, what we can do to make things better, things that are going to be challenges. But I have never discouraged a student who wanted to go into ophthalmology, whatever their score was. I just thought, who on earth am I to rain on somebody's parade if it's their lifelong desire to apply in ophthalmology? I have to tell people the truth about, what the odds look like. And then I fight like heck to try to get them into a residency program.